Hi guys, my name is Samuel Ford. I am an emergency room trauma certified registered nurse. I've been doing emergency room for the last 4 years. I got my bachelor's of science in nursing at the University of Central Florida, and I've been doing emergency room ever since. My first 2 years, I got straight into a preceptorship in the emergency department. It was a 19-week program where you and a preceptor learned the ropes of the emergency department and really learned the basics, and then you were off on your own. After I fulfilled my first 2 years at the Florida hospitals, then I was able to be free and do travel nursing, which I do now. And it's really been an incredible experience. People hear a lot of things about traveling nursing, and there's pros and cons to both. Obviously, some of the best things about travel nursing is that you get to go wherever you want. You get to explore different states, different atmospheres. You get to go on vacation without really having to take any PTO. But it also has some of its downsides or has some of its challenges. Sometimes you have to be away from your family and loved ones for long periods of time, and sometimes there's not always opportunities, the places you want to go. So you really kind of have to take into consideration what works for you and your personality before you make the decision to go travel nursing. Now, after Orlando, I made the decision to pursue pediatric trauma in the Austin, Texas area. From there, I went out into the Appalachians to explore more of a rural side of healthcare. Then I went back to Orlando to recharge my battery for a little bit, and then I moved from the East Coast all the way to the Pacific Northwest, where I am now. It's beautiful up here, very scenic. It's been more elevation than I'm actually used to. I'm getting a nosebleed just standing here, probably. No, it's not quite that bad, and it's been fantastic. And the best part about emergency medicine and nursing in general, it's one of the most flexible careers you could ever choose for yourself. It's dynamic, it's challenging, it's enriching in more ways than I could put into words. But for the past 4 years and for the rest of my professional career, I'll choose to explore nursing, do my Master's of Science in Nursing as a nurse practitioner, and then move on to the DNP, Doctorate of Nursing Practice, to finish my career. And that's just the beginning. So yeah, that's me, and that's what I've chosen to do, and that's where I am.